Hi, Tina. Very happy to have you in our podcast today.
Hi, Max. Good to see you too. I'm looking forward.
Yeah, same. Absolutely. First things first.
Mhm.
Do you maybe want to tell us a bit about yourself, what you've done so far? I know you've done some super interesting things and what you're currently passionate about and what actually the drivers are for you in doing all
Yeah.
that.
I mean, above all, I would say I'm truly passionate about precision diagnostics because, we all talk about precision medicine and so on, but the fundamental part that would make a difference is, I feel, the ability for individuals to have preventive care and at the same time have a more precise diagnosis to be able to find the disease, the right disease at the right point, or early detection, right? Because once you do that, everything else, whether you have to treat or not treat and so on, everything else follows. So this is what I'm passionate about and what I currently work on. My history is a lot on radiology and oncology, but what I currently work on
Yeah.
is pathology because, going from the whole anatomy to really down to the tissue, cell, molecular level, being able to analyze and diseases and detect them early on that level, it's so fascinating. So this is what I truly enjoy. And what I also currently do, it's a transformation, whether we talk about AI as a transformation, similarly, pathology is going through a transformation from conventional to digital. And my role, I would say, is the intersection of truly understanding the clinical value, like what is value for the customers, and then understanding where to apply the technology, like digital and AI tools, and ultimately, it's about creating value for the customers and then also for the business as a scalable business, right? So
Yeah.
this is what I'm doing right now.
Nice. Was there between all the chapters that you walked through so far, was there one main driver that ties all of them together?
I know. There is one. I did draw a little sketch to you to elaborate my
Yes,
point.
please.
And I think many of those in healthcare would understand this, whether they know Michael Porter or quadruple aim and so on. So it's a very simple sketch, right? So I look at it this way, very simple. First of all, value in healthcare is about creating a difference for each patient. It's about bringing them back to a healthy state as quickly as possible. This is what patients care about, right? And then ultimately, the burden is increasing in healthcare, the number of cases. When you think about preventions, early detection, screening, and so on, it all adds cases. If you talk about precision medicine, having multimodal information to come to a precise diagnosis and treatment decision, it also has like a lot of cases. So ultimately, the disease, let's say, burden is increasing and the healthcare system clinical burden is increasing, right? So this is where we can create value by making it more efficient and reducing costs.
Yeah.
And ultimately, it's about keeping people happy, whether it's patients, right? First of all, but at the same time, the clinical staff, right? If they are stressed and not able to focus and so on, and it's like all these AI alerts is not going to do the trick. So how can you really delight them with the solutions and tools that we offer that they can do their job with ease and they're comfortable and giving that patient the feeling that they're in full control of their health management, right? So that's a simple picture that always motivates me. And I guess I will use that as a storyline for my talk. But what I'm saying is whether it was Siemens' journey, my Philips journey, my Evident journey now, I learned a lot about radiology, how that contributes to diagnostic insights. I've learned a lot about pathology now and how tissue, cell, molecular level contributes to those insights. And ultimately at Philips as well, I was leading digital and AI innovations there. So really built a lot of tools that are creating that value, but it's also reliable, explainable, and scalable, right?
Yeah.
So ultimately, it's about the trust that you can also deliver. So this is what motivates me very much.
Very nice. The sketch that you just showed us,
Yep.
do you see that as a circle that's reinforcing each other or
Yes.
as standalone parts?
No, it's a circle, right? So, I mean, I guess when we talk about trust, right? So, for example, the trust comes when you're actually able to provide the right diagnostic accuracy
Yeah.
consistently all the time, right? When it's reliable, when the solution is not working in some cases and not in the other, and it's actually reducing the cost, right? So, and things like in AI, we talk about explainability, transparency, right? So all these feed into each other, and you're absolutely right. It's all connected, and this is where whether it's larger companies, medtech companies, or startups thinking about solutions, it's this interplay and recognizing that not everything is your expertise. You need partners, you need ecosystems. So it's like this interplay that's so important to truly understand.
Yeah. Super interesting. I mean, you already touched a bit upon that. I think like a lot of people, they use like AI in healthcare as one single phrase. And you
Yeah,
already mentioned that it's like very diverse. You have, I don't know, radiology, pathology, you already mentioned monitoring workflows, payments, so
exactly.
on and so forth. Like, how would you define the landscape behind all that?
Yeah. So if you think of AI, right? Let me zoom into like 2 dimensions. So
Yeah.
first dimension is again, a lot of the AI started off with operational efficiency because that's where let's say the clinical staff are really good at what they do. So they're like, okay, take away my administrative burden, take away my problems where I have to manually enter things, or I'm making a mistake because I'm just redoing the same thing multiple times. So bring me the efficiency or show me what I have to prioritize by triaging, right? So all those use cases are number one because it is really important that you relieve them that they can do their job best, which is taking care of the patient, right? And then of course, going forward, like what customers are already accepting and adopting is assistance with AI, like truly clinical assistance, right? And this dimension actually means being able to detect early. I mean, imagine looking at cellular molecular level information. This is not something you can do with a naked eye. If you want to see a minor change in the tissue characterization with an MRI, or if you want to look at let's say a gene displacement or multiplication, you can't do that with the naked eye. So this is where AI assistance comes into play, this whole prevention, really early detection, right? When it comes to late detection, maybe like as an example, in the case of cancer, the tumor is big enough that you can see, or if it's a stroke and so on. Again, maybe you can actually visualize, but then it's coming later, and that might happen. And the question is, how can you precisely triage this patient and identify what stage they are in? What is the disease prognosis? What can I do to prevent, it becoming more aggressive or worse, right? Or which targeted treatment do I give? And nowadays, there is more and more. I mean, we wish for personalization and individualization, but it's getting there. It really means trying to understand the patient's a holistic situation, their holistic diagnostic information, their lifestyle information, their diet, their exercise, all this, everything together plays a role in deciding what is a personalized treatment for this patient, right? So
Hmm.
that's the other dimension where AI comes into play. Um, you can support them in many ways, and also in ultimately monitoring, making sure that companion diagnostic, making sure that treatment is working, or after the treatment, making sure that the treatment has been really effective and there's no recurrence and so on, right? So this is where a huge spectrum of AI innovations is possible. But last but not least, not to forget, to build the trust, again, you have to think about the customer and the patient delight, like easily explainable, transparent, and so on. So that's what would excite them to use the solution.
Yeah. I mean, now I also know that you said it's not about the big breakthroughs in general, but it's more about I think you call it the harmony between the clinical value, technology, and business outcomes.
Yeah.
How does this harmony look in practice?
Yeah, I mean, when I talk about this harmony, right? This little triangle. So first of all, it's not like a tech push or an AI first push. You might say an AI first approach to understand, but it doesn't mean you start with the AI, right? It always starts with truly understanding the clinical workflow, the clinical need. And again, clinical workflow doesn't mean, oh, today is analog, so let's make it digital. It's really re-innovating and thinking, what is an ideal clinical workflow? What are they trying to optimize? Is it turnaround time? Is it diagnostic precision? What is it that they are, or is this lifetime cost for a patient? Like, what is it they're trying to optimize, right? Then redesign that workflow and truly understand what value are they trying to create. So that's its clinical value. And then comes the technology, or in other words, what kind of digital AI solutions will make a difference? What kind of data do I need, right? So the technology comes after. And then, of course, the third part is then the business from both perspectives, right? Even healthcare systems, I mean, of course, they will not say I'm a business, but in the end, they also want to make sure that they cater to more patients, they have better revenue, they are able to manage the cost. And from edtech companies and so on, we are making sure it's a scalable solution, it's sustainable, it's differentiating value, right? So this harmony is what matters, right? And the whole thing is a feedback loop, but we can talk about feedback loop later.
Yeah, cool, interesting. I mean, I know that implementing AI projects in general is super difficult. Like, I think there was this MIT study now 2 months ago saying that most of them fail. I know AI in healthcare is even more tricky.
Yeah.
What do you think? Why do so many projects fail? Why is it so difficult? Is it because the workflow, the adoption? What's the
Yeah.
reason?
Um, I would start with again this value, right? So if a lot of the, let's say, really smart people who are coming in AI, right? Really smart, they know the technology, but they might not understand the clinical value, the clinical workflows, right? So this is where I think if somebody wants to innovate, create value with AI in healthcare, they truly have to understand what that value means, that whole value chain and the workflow for the patients and the customer. So that's understanding the value, and sometimes that's where there's a shortfall and a challenge. And the second part is it's integration, right? It's a workflow. So in other words, every individual vendor cannot just go to the customer and say, "Here's my piece of solution, and here's my piece of puzzle. You figure out how the puzzle fits together," right?
Yeah.
And that doesn't work. I mean, so this is where it's like an ecosystem and a partnership where both parties want to understand how does this puzzle fit together to create my ideal workflow, and you need to interoperate. You cannot be like a closed system or a closed ecosystem. You have to be open, so you need to make sure that the data flows. And which data? It's patient data, it's operational data, right? I mean, you're talking about having holistic patient information, and then you have all these siloed pieces of information, and that just, making it more complicated. So understanding the value, understanding how to integrate, and last but not least, I would say it's also the trust that drives the adoption. I mean,
Yeah.
you can create a great solution, but if it's a black box or not explainable or it's not intuitive, I'm making a mistake sometimes. All those aspects, the whole user experience and building trust becomes absolutely critical as well.
Yeah, definitely. Do you also see that implementing AI in like this regulated clinical environment is fundamentally different to implementing it in other sectors? I don't know, finance, manufacturing, where it's way less regulated?
Yes, I mean, very simple, right? You and I care about it that if you're sitting in front of a clinician, you wanna be able to trust what they're telling you. You want to be able to make sure that, hey, if they're using digital AI tools, it's trustworthy and so on, right? It's safe, it's effective. So
Yeah.
ultimately, when we are creating solutions in MedTech, we have to really make sure it's reliable, repeatable, trustworthy, but at the same time that you're following all the regulatory and clinical standards, right? And ultimately, we all talk about speed and agile, and that doesn't mean that in healthcare you can just create an AI solution and bring it out there and see, oh, let me test if it works on the next patient, right?
Yeah.
That's not how it works. It still needs to be really controlled, how you deploy it and how you get the feedback and do a post-market surveillance and continuously innovate, right? So that's why it's more challenging than probably in other sectors where you can, nowadays they deploy, I've heard them deploying millions of AI every week and so on in booking.com or other companies, but that's not the case in healthcare, right?
But I guess there's a good reason behind, because to be frankly honest, I don't want to be the first patient where a new AI solution gets tested on it without it being regulated. So
Exactly. All these clinical trials and studies that we do, not from just one center, but multiple centers, all that plays a role in building that evidence and the trust.
Mhm. I mean, for an actual AI solution then being really adopted, what do you think is the most important thing? Like, what needs to be adopted first? I know you said explainability a lot, but is it that?
Yeah. For me, the adoption really drives to the triangle. Like, first of all, create the right value, so the customers really feel that it's a value for them. And like you said, they all interplay. You cannot just say, um, in the beginning there were solutions that said, you can increase the speed by a minute. Okay, how is that helping me in the grand scheme of the workflow? Or if I say, yes, this solution works for this kind of patient, and maybe that's only 2% of the cases that they have. Okay, great. Why am I adopting that? I mean, sorry, it's only working on 2% of the cases. Or put it in pilot mode, right? Or in other case, like, it's great, but it doesn't tell you what is the confidence you can have in there. Use it at own risk. It's your decision in the end, right? Like, and they're like, okay, can I really trust it, right? But so all these factors come into play for adoption. And then I mentioned integration is so key in the workflow, and trust will come. Trust will come when you actually regulate it, integrate it, show the value, and all these pieces, right? And I know it's not easy. And going back to your previous question, that's why it's not easy in healthcare. But, when you're really passionate about it, when you really understand, when you spend time with the clinical staff, with the patients, it's just a matter of time you really understand what the value is, right? It's not so complicated. You will get it because either you or me or our family, somebody has been a patient. So it's not so complicated if you just observe what happens.
Yeah. I mean, I know that for many startups, it's very difficult, or let's say they underestimate the importance of this clinical value story. And I know that's exactly your role and you're very good in that, but how do you actually communicate this value to, on the one hand, doctor labs, regulatory teams, and also business stakeholders on the other side?
Yeah. So especially when you're developing your value proposition, your strategy, you have to have a clear understanding of all the stakeholders, the personas, and all the players in that whole workflow value chain, right? Or whether you call it pathway, whatever, right? So in other words, you can't just talk only to maybe the radiologist or the pathologist or the clinician. You can't talk only to the lab manager or the purchasing department or the IT, right? So, and not to forget the patient, right? In the end, if it's directly influencing how decisions are made for them, and the clinician is communicating that, right? So all this matters. So when you're designing a solution, your value proposition, the whole stakeholder persona understanding is so critical, and being able to articulate your value. So your clinical value, your financial value, your operational value, your patient and staff experience value, right? In the end, it's not just one patient. Is that how does it accumulate over the whole population or multiple patients they see? Or another dimension of thinking is, one patient has a journey, there is a pathway, there's a total cost as the pathway. How can I optimize the total cost? So once you understand that, you will articulate that better.
Yeah, makes a lot of sense. Makes a lot of sense. When we come to the AI use cases that are working today already,
Yeah.
I also know that now digital pathology is one of the last major diagnostic fields that is going fully digital at the moment. Where do you see AI use cases that are already delivering actual value?
There's a lot of solutions, for example, that improves the workflow, that automates, for example, quickly triages the scans and says, okay, now prioritizing them by saying, okay, what is most urgent to attend to. Then there are solutions that is already extracting a lot of information from whether it's pathology or radiology images. For example, whether it's mitosis counting or certain segmentation, even characterizing, or like in a PET CT, looking at SUV values and quantifying them. So there's a lot of automatic calculations and pre-processing that is done, right?
Yeah.
Then, of course, value like a lot of voice recognition systems where you can just talk to the system, easier to handle the report. Nowadays with generative AI, there are early solutions that also talk about how can I quickly summarize the report, how can I quickly show where there are errors in the report. Maybe two things that they wrote are not concordant. Let's say they mentioned a particular size of the tumor, but then they call it the virus 2, maybe not, So this kind of discordances and so on where AI can help with. So, and ultimately AI solutions, even like the voices, I would say delighting the customer, or maybe touch-based solutions where you can quickly look at the details of why it's actually come to this conclusion. Like when you're monitoring a patient, imagine a patient in the ward, you're monitoring many things, their respiratory condition, whether they might go into a septic shock, or, maybe their kidney function. So you're monitoring everything. Where do I pay attention? Because I have so many patients to take care of, right? So all those solutions are already adding value, but there's more to come. It's only the beginning.
Yeah. I mean, is there also, on the other hand, are there some solutions that you think they're extremely excited on paper and you would love to have them, but we are just not there yet?
Well, if I think of pathology,
Yeah.
for instance, right, I would say, this whole spatial biology and so on is getting very fascinating because it's in simplified words, what it's talking about is you're not just looking at an individual protein or cell, you're also looking at the interplay of the cells in the spatial surrounding, because all that adds to, for example, in the case of cancer, all that adds to your understanding of the disease characterization, right? So that's getting fascinating, but it's still a lot in research. If you think of multimodal, this is where I think a lot is heading, Multimodal, we talk about it in other industries where you look at video information, voice information, image, text, everything, right? But multimodal in a precision diagnostics, like looking at radiology, pathology, the clinical notes, the lifestyle factors, other comorbidities, everything. That is complex, and so that's another dimension which I would love to see, but it's complex, it's coming. And last but not least, I would say, there's a lot of focus on some diseases because we have to start somewhere. So everybody started with the biggest burdens, whether it's oncology, cardiology, and so on, right? But there's a lot of diseases, rare diseases and conditions that patients suffer from as they live healthy, but now getting older and have chronic conditions. So there's a lot of these innovations I would love to see is coming out soon.
Yeah, awesome. Yeah, fingers crossed for that coming out.
Yeah.
Looking forward to it. Coming with, I know that you also know you led like cross-functional teams like business AI, product strategy, go-to-market teams, and also now M&A. how do you prioritize out of all the possible solutions out there that exist and that you want to build? How do you prioritize what to actually build versus partner versus acquire?
Yeah. I mean, first of all, you got to understand how you're creating value, that workflow, that value chain, what is value for the customer, right? Once you understand that, you need to understand where are your core capabilities and strengths. You need to understand, for example, what are you going to focus on where you know that you can create a differentiating solution, you can create, let's say, a sustainable, scalable solution. You need to be really clear of your capabilities to do that. And then it doesn't mean that you have to address everything in the workflow. Like I alluded to before, partners and ecosystem plays a key role. So in other words, truly understanding your control points, where you want to give control points to another partner because they are strong at that. What is your win-win solution, right? Like how can you bring that to the customer? But also doing all that design thinking together with the customer to really see is that their ideal workflow, right? So really understand the partnership solutions you want to build in that ecosystem. And last but not least, sometimes some of those partnerships can turn into M&As. For example, either it's accelerating, speed is so important nowadays. Every day there's a new solution, right? So speed is of the essence.
Yeah.
So because of speed, you might want that, or maybe you miss a capability, or you want to have a certain control point in the workflow. You think that those two control points would bring you that unique differentiation. Those are all the reasons then you might look at an acquisition or a bit more of a strategic alliance than a straightforward sort of win-win partnership, right? So a lot of things come into play, but all starts with, understanding what is the value you're creating, and from there it begins.
Yeah, interesting. What have you, regarding that, what have you learned about the right team structure for, let's say, digital pathology and AI innovation and
Well,
managing this process?
Early on I was talking about the feedback loop. Maybe I will use that now. So I look at this feedback loop in the following way. So first of all, when you think of digital and AI innovations, you will succeed only if you have collective intelligence, if you're learning from with the customers, or let's say clinical staff and patients who are going to benefit from the solutions. It's not like in the past where you create an innovation, don't talk about it, I'm just going to hide it, I'm not going to mention anything, and suddenly, voila, I have a solution, right? It doesn't work anymore. So how do you really co-create with the stakeholders that you're creating value for? So, and then the feedback loop means you need to create that channel to get that continuous feedback. Otherwise, you're not improving that solution, right? Then, of course, this, if you think of that, there are different stakeholders like product managers who want to understand the customer needs and acting on behalf of the customer, strategists who are really looking at how you're going to scale the business. Then you have innovation and R&D teams who are really looking at the holistic solution. You have the AI algorithm experts and the data experts who are thinking of, okay, now what AI am I using to create the solution, right? You have regulatory experts, you have user experience designers, you have customer experience experts or specialists. So you see a lot of stakeholders come into play. So what is important is if you have the why, the what, and the how thinking. So first, truly understand the why and what I'm going to do. How am I going to get this continuous feedback? How am I going to be creating sustainable continuous value? And then how am I going to set up my team? Who are all the multidisciplinary team members I need on my side? But at the same time, the customer partners also need that. We mentioned earlier, there are value to different stakeholders, right? So there are different kinds of value. So you should make sure that there's a multidisciplinary team that you're also co-creating with, because then you can understand what value is for each of them, right? So that's how I would go about designing. And it doesn't mean you have to have a huge team. And that's where the lean thinking comes in to say, okay, what is that minimal effective team that can work with speed? Otherwise, you just have a monolithic, huge team that's not bringing speed.
Yeah. When you see other companies starting their AI journey, is this missing feedback loop one of the first wrong moves that you see?
Well, of course, you may not get immediate feedback from a wide number, in the first instance, right? But being able to set up that team structure, infrastructure, thinking about post-market surveillance, thinking about that feedback loop is so relevant. I'll give you one simple example where it was an easier first AI solution we could have, right? Ultimately, you need to show all these medical devices like scanners and so on have very high uptime, no downtime. It's always working. So predictive maintenance or preventive maintenance became very relevant, which means that you have to think about how am I going to observe my systems out there? How am I going to get the data back? How am I going to get feedback when some spare part or some part is going down and I have to replace it, right? Which are the parts that are typically going down fast, right? So then I have my inventory ready for that. So all this, if you don't think about it upfront and you do that as an afterthought, it becomes harder. So your question is spot on in the sense whether it's a startup or any company really creating value with AI. It's not a shortcut. Don't take a shortcut. Really think about it holistically. How am I going to create this sustainable value?
Yeah. I think I figured out that unluckily there are never any sustainable shortcuts most of the time.
Yeah, that's right.
When we look a bit in the future, let's say in 2030, do you imagine diagnostics being AI first with human oversight, AI assisted workflows led by clinicians, something in between, something more on the extremes?
I'm going to say two things. So first of all, the end value is going to be AI assisted. In other words, you are assisting many of the clinicians, radiologists, diagnosticians, or pathologists to be able to do what they do best, right? To be able to be more precise and accurate with the diagnostics or diagnosis, or to be precise with what is the best patient management step in the situation. So that is the ultimate goal. Having said that, there will be many cases where it could be AI first. In other words, if there are repeatable tasks, very simple cases like triaging, really prioritizing and all that, that will become more and more automated. It will become more and more AI first because it enables the clinicians again to do what they do best, which is focus on the right patients at the right time, right? But then going back, even when we are co-creating the workflows, the new AI-based workflows, you got to have an AI-first approach. That doesn't mean only AI or complete autonomous AI, right? It means take an AI-first approach. That is, don't just take the current workflow and think, oh, okay, how am I going to tweak it, right? Really re-innovate. If I could have everything, all my AI tools, how would my ideal experience look like? And then work backwards from there. So, it is an interplay, right? It's not like one or the other, but there's an interplay and how you think about that.
What do you think is the most that will tangibly improve for patients and also professionals in healthcare?
Tangibly. Well, what do I as a patient care about? So first of all, I would love to stay healthy, to be able to get the guidance to stay healthy. I mean, there are things that if I just speak for myself as a patient, right? Things that I didn't know in the past. And now I know what I should do, what fits my body, what fits my comorbidities, and because of which this is the diet that I should have, and so on, right? So enabling the patient as much as possible, and nowadays there are more informed AI first patients. So enabling them with the right information to take better care of themselves, And then, of course, tangibly making sure that you can detect diseases early, you can really prevent them as much as possible, right? So this should be like a real mission, right? And then ultimately, of course, things always happen no matter what you control, right? It's never going to be perfect. So you will have situations where you need like a treatment, whatever treatment but being able to do that right treatment with the minimal side effects, best outcomes, right? Being able to do all that. This is what patients really care about.
True. Do you also think there's one underestimated impact that we're gonna see in the next years in, I don't know, pathology, healthcare, and AI?
Underestimated impact. Well, um, if I look at the speed at which AI is going, like innovating with the generative AI and with all agentic AI solutions and with also like the whole artificial general intelligence that's going to come more and more, I think we're underestimating the influence and the impact AI can truly have on healthcare. So maybe in the next few years, I think it will really define how companies adopt these AI solutions to give better care for the patients. Because if you underestimate what the possibilities are with AI, then I think you will not be creating the right differentiating value and scalable value, right? So yes, I think there's underestimation of the speed of innovation that's possible in healthcare. So yeah.
Cool. Very nice. I also have prepared one sentence for you. I would love for you to finish. If
Okay.
that's fine for you. So I wrote down, AI will transform healthcare when we learn to.
When we learn to co-create and design the solutions, I would say, with the clinical staff and the patient, right? So I think I said a lot. So that's where I would say that's
Great.
very important.
Very nice. And lastly, maybe as the last question, if you could give one practical step to any hospital lab or wherever that they can take tomorrow to actually prepare for the future, what would that be?
Yeah. So, I mean, don't wait thinking, let me see how others are adopting AI and digital solutions. Don't wait for the transformation wave to happen. I mean, it's happening. And if you're not starting and experimenting yet, that's a problem. So I would say my advice would be think big, act start small and act fast, right? So in other words, think big in the sense, really think the holistic, where do I want to be? What's my North Star? How am I going to get there, right? So really think big and then go work backwards from there and say, okay, what are my steps? What am I going to experiment with? What am I going to start with? And once I understand what works for me, it's not the same recipe or solution for all. Everybody needs to think of what is their core capability and strength and what is differentiating value they want to create in a sustainable way and profitable way. So if they really understand that, they will know the steps to take. And once they get it, scale fast.
Awesome. Tina, thank you very, very much for taking your time. Thanks a lot for sharing your knowledge and with doing that with such enthusiasm. Really, really enjoyed talking to you, and I hope all the others did too. Thank you a lot.
Thank you. I enjoyed our conversation. Very nice flow of discussion. So thank you so much as well.